Hello everyone and welcome to another IGTV. Today we're going to be talking about oncology skin. So an oncology patient is someone who has recently gone through or is currently gone through chemotherapy or radiation treatments. Chemo and radiation can change the skin in a number of different ways. It can make it extremely fragile, thin, tender to the touch, dry, and extremely dehydrated as well. The focus while treating oncology patients is to help bring their skin back to its integrity so that it can withstand oncology treatments. Now, changes to the skin usually appear about 3 weeks after undergoing chemotherapy or radiation, and you will notice a couple of differences whether your client is going through radiation or chemo. After chemotherapy, you can expect extremely dry skin, itchy skin, rashes, hyper or hypopigmentation, and an extreme sensitivity to the sun. This usually does occur about 3 weeks after your client does undergo their first round of treatment. Hair loss can occur 10 to 14 days after the treatment, and that is because the chemotherapy can cause damage to those hair follicles. Chemo can also affect the scalp in more ways than just hair loss. Your client can experience eczema, psoriasis, extreme tenderness in their scalp, and also folliculitis. Radiation uses high energy to directly kill those cancer cells. This is a more direct approach than the chemotherapy. After radiation, you can experience dry skin, erythema, hyper or hypopigmentation, and photosensitivity as well. After chemo or radiation, you do want to avoid harsh products, and you really want to only use gentle products, whether it's on your face, scalp, or body. If you are treating oncology patients, it is important to know the products that are okay for them to use and that are not okay for them to use. You do not want to do any sort of aggressive treatment on an oncology patient for at least a year. You want to make sure that you are giving the skin time to heal and to rebuild itself, because it can become very thin, fragile, dry, and extremely sensitive as well. Oncology patients do need to avoid products that have fragrances, soaps, hot water, chemical peels, mechanical exfoliation, sodium lauryl sulfates, and perfumes as well. Anything that can cause inflammation in your client's skin can lower your client's resistance, compromise the skin as well. Since when you're treating an oncology client, you're not really going to be doing more of those results-driven treatments. You're going to be using a lot of gentle products that are going to boost the hydration in the skin. You can use something gentle like the Youth Firm Age Defying Peel to give your client a little bit of that exfoliation that their skin does need, but you also want to make sure that you're being extremely gentle. Treat the skin like it is very thin and fragile skin, and make sure that you are giving your client a lot of love and take extremely good care of your client during this time. You want to make sure that you are washing your hands before even meeting up with your oncology client, and washing your hands again before you even start the treatment. Sanitize and disinfect everything that is in the treatment room. Your client is very highly susceptible to any allergens, bacteria, anything that could be in the treatment room. Your client is extremely sensitive to those at this time, and they can get sick extremely easy. So also, I know we are all wearing a mask right now because of COVID, but even after COVID, make sure you are wearing a mask when treating your oncology client as well. Make sure you are using non-latex gloves while treating the oncology client. Now, you also do not want to do a treatment on your client until 7 to 14 days after they have received their chemotherapy or radiation treatment. So you do want to give them that 7 to 14 days before you even treat them. When treating an oncology patient, we do need to make sure that we are not only giving their skin some extra TLC, but we need to also make sure that we are giving our client that is currently going through the oncology treatment some extra love and attention as well. This is a very difficult time for our clients, and we need to make sure that we are giving them the love and support that they need in order to feel comfortable and taken care of. We do have a gift known as Maria's Gift here at GlyMed. This is a donation that we make to people who are currently undergoing cancer treatments, and it includes products that are going to be very healing, soothing, and moisturizing to the skin. We like to do this as a way to give back, since we all know the pain that cancer has caused to a lot of our lives. So I am going to demonstrate an Oncology facial for you. If you are interested in this facial protocol, you can request it from your account manager or business coordinator. All of the products used in this facial will help to heal, protect, rebuild, and moisturize that fragile skin. If you have any questions regarding this facial or any of the information in this IGTV, please reach out and we'll be more than happy to help you. And also, if you know anyone who would be interested in the Maria's Gift donation, please reach out to your account manager about that as well. I hope you're all doing well. Bye.